Hey there, it's Crystal with Heart Stories, where we reconnect busy women to inspire the joy you crave and the courage to pursue your purpose. And I am here today with Dr. Jay Woody of Legacy ER and Urgent Care, where they have 6 locations to serve you in the Metroplex. Dr. Woody is the founder and chief medical officer, and I am so grateful to have you here with your expertise on all the things today. Welcome.
Thank you, Crystal.
Sure.
Glad to be here.
We have all the questions for you. We are obviously still in this crazy pandemic. We have COVID questions. We have back to school questions. We have questions about just the strains and sprains and injuries that have happened on the sports fields now that the kids are kind of stumbling their way back out. So let's first start. I think the hot-ish topic still is back to school. So what are your thoughts about kids being back to school still in the middle of a pandemic? What can we do as parents? Like what are the best proactive steps, I guess, sending our kids off to school? And then let's ask that first. Well, I have so many questions. Let's start with that one.
Sure, we'll start with that one. So I think it is good for the kids to be back at school if the schools are prepared to take on the children and make sure that everyone is safe there. I do know, at least here locally, the schools are doing a great job of trying to protect our kids and make sure everyone's safe. And thus far, happy to say, at least from my knowledge, that we've had very few cases. So that is good. I think it's very challenging for us as parents and for the kids to sort of comply with all the rules and recommendations. And I know that everyone's putting out a good faith effort in that. And I think that's the most important thing to do, is to encourage the children to follow the rules. And for example, if masks are to be worn, to make sure you do wear your mask, and the mask needs to cover the nose and the mouth, or else it's not effective. Some things that you mentioned earlier before we started, hand hygiene, doing all those things that we now know very well, since we're so deep into this pandemic, that need to be done. And just helping to remind our children, because sometimes they forget, same as us adults, but just to remind and encourage to follow all those best practices that are being put in place to keep us all safe.
Yeah. And I think too, we talked about the benefit of the mask, and there's the whole polarizing political mask debate, but scientifically, the benefit of the mask, if both people are wearing the mask, it limits your exposure significantly. It's not 100% foolproof, but it does limit.
Absolutely. And again, I'm just speaking as a physician, and the masks do work. That's why I've been wearing a mask my entire career to keep my patients safe. And so now it's definitely a tool. It's a simple tool, and it's a cheap tool that we can all use to help essentially protect each other. So I think, for me, it's I want to make sure that I'm protecting you, and I hope that you would have enough consideration to protect me. And so definitely can decrease a spread by up to 80%, depending on the type of mask. And so that's definitely something,
Huge.
I've got a whole barrel of masks in my laundry room now, which is something I don't think I would have ever known that I would have. And so taking a mask, I've got them strategically placed in my car, in my pocket, and at work, all over the place to make sure that I'm always ready for that mask. And again, back for the kids, making sure they don't leave home without their mask. Because I know, at least at my house, first couple of days, we had some mask forgetting. Unfortunately, there was some backup mask in the car. But that's where we can help our kids protect other kids at school.
Absolutely. And also, I know we talk about how the kids seem to have fewer symptoms, seem to be less sick than the adults, but they're protecting the teachers also, so that we can continue to have teachers. But and this is a little off the topic of back to school, but what have you seen clinically from the exposure for kids? Because or the level of illness, the younger you are in general, the less symptoms you seem to get. Is this true, or is this?
So it is true. Now the children are actually being infected with COVID-19.
Yes.
They're just not showing symptoms as commonly as older people show them. So I think that's the challenge, is that the kids may have it. And that's the whole challenge that we're dealing with in this pandemic, is that about a fifth of people that are infected, and I'm talking about all comers, not just children, but have no symptoms. And so that's the challenge, is because that's just enough people that are out in the community to keep the virus spreading on a daily basis.
Yes.
And so the same with the kids is they don't show symptoms as commonly as adults. They still have the infection and they can still spread it to others. They themselves just aren't getting the classic sort of body aches and fevers and chills and cough and things that the adults are getting.
Right, which makes it exceptionally dangerous. We were talking about college students that are out there, become our super spreader population.
That's right.
Don't have any symptoms, so they don't think they're sick, and they're around older people and spreading it to people who then get sick.
Right. And they also believe they're invincible. So that's
Yes.
another factor that you have to put in there.
Yes, goodness gracious. Okay, well, so back to school. So we talk about, like, with all the schools have different, of course, rules in place and processes, and they're doing such a great job. So we're going to abide by their rules and processes. But as far as we're concerned, if we find out, let's say that we were exposed at church or at another community event, what is and I'm going to call it the incubation period. There's probably a better name for it, but like, how much time needs to pass between the time you had a positive exposure? I guess let's start with that. What is a positive exposure event? How much time needs to pass before you can get a valid test result that you would trust?
Sure. That's a great question, because I think that's where there's a lot of confusion. And I think
Yes.
there is a lot of confusion around this too, because we're learning new information on a daily basis. And so the roles today are different than they were last week, which, if you weren't keeping up, and I can barely keep up myself, then the answer is different. So I think that is, just throw that challenge for all of us out there. But back to your original question, the technical exposure is that you were around someone who is positive and you were within 6 feet of them for greater than 15 minutes. So that is the sort of textbook for today definition. I think we all have to just sort of be reasonable about it. And, if you were around someone for some period of time, whether, super close or not, I think you just kind of have to decide what you think is the right thing to do. Do I need to quarantine? Do I need to get tested? And make that decision, just depending on how close you were and how much time you spent with them.
Question about that. Is outdoor the same as indoor exposure? We did not talk about this, but I keep thinking it on the sports fields and seeing people wearing masks, riding their bicycles. Like, what is it the same outside?
So another excellent question. Outdoors dramatically lowers your risk because there tends to be more space. So you can be apart from each other. And so, for example, just some reading I was doing about dining indoors versus outdoors. The dining indoors is actually one of the riskier things to do, because there are no masks being worn, and the air is sort of stagnant. There's no breeze blowing through and whatnot. So, and you're usually closer because you're in a confined space, even if you're doing social distancing, depending on where we are with the government's stance on that currently. So, outdoors, we have more space, we have a breeze, we lower that risk. There still is a risk, but it's not as high. For example, to your question about riding a bike, if you're riding a bike with your buddies and you guys are close together, I think that, the best practice would be to wear a mask. But if you're far apart and you're zipping down the street on your own, then there really isn't a need to wear a mask. It's really about the closeness. Just outside or inside, the closer you are to someone, the higher your risk is. The farther apart you are, the lower your risk.
Makes sense. Yep. Okay. And so then exposure time, how long before you have a positive exposure to when you should get you could trust a valid test result?
Right. And so a little bit of that depends on the specific test that you're getting, but in general, what I would say is if you are exposed today, it doesn't make sense to go get a test done today, because your test, assuming you didn't have the infection previously, it will be negative, because there hasn't been enough time for you to accumulate enough of the viral RNA or the proteins in the virus for the test to detect it. So what I would recommend, ideally you wait 5 days. Most of us are too impatient for that. And so, but the truth is, as you get closer to that 5th day and beyond, the test becomes more sensitive. So I think you getting a test even tomorrow, if you were exposed today, will most likely be negative. And I think the biggest risk is that then you would have a false sense of security thinking, oh, I'm negative, I had a test done, but really the test wasn't a valid test because there hadn't been enough time that had passed from the exposure to be valid.
So you really want to wait at
You
least
really want to wait, and you should,
5.
that's right. You should quarantine during that time as well, because at some point you do become contagious.
Yes. Somewhere in that magic
That's
period
right.
where you're going to become, where it's going to be testable.
That's
What
right.
is so you mentioned the different types of testing, and I'm fascinated by this. I'm assuming others might be as well. There's the antigen test and then the protein serum test, or what are the two tests?
PCR.
Okay.
Polymerase chain reaction is the
Okay.
PCR stands for. And then there is the antibody test.
Oh, that's the one I was thinking. And the antibody, okay, so tell us about those. How long let's say you wait 5 days. When did you wait too long? When is the virus gone from your system where it won't?
That's a great question, and it depends on the person, because sure. What the tests are, two categories: the antigen and PCR test. They are detecting active disease in a person. Mm-hmm. Different than an antibody test, which detects antibodies, meaning that you had the disease previously and it's gone. So there's two classes. The test that you're looking at when you waited the 5 days, that would be the PCR test or the antigen test. And again, they're both looking for active disease. In theory, after 14 days of being sick, those tests would be negative. But what we're finding is that some people, even though they're not sick anymore and they're not contagious anymore, they're still testing positive, because basically the test is looking for fragments of the virus, and it takes some people longer time to clear the dead virus. And so even at 3 weeks, 4 weeks out, you might test positive, but it's dead virus that's being detected. And so that gets a little challenging, because if you need a negative test to go back to school or work, you can see how that could be problematic.
Sure. Yeah.
But most people, after the disease the sickness has gone away, they're testing negative for those two. Now, subsequently, a month out from having active disease, that's where the antibody test would show up. It's meaning, hey, you got sick, your body fought it off, and now you have antibodies in your system to the COVID-19.
And how long, maybe this is a magic question, but how long do the antibodies protect you or last, or do they protect you, and how long do they last?
Well, we'll have to do that for the next the next get together, and after we have a year or two of data behind us. So the answer is we don't know.
Sure. Okay. I trust you on that, because I've read about it and I haven't found any answers that suit me.
Well, there definitely is protection that you have. The question is, how long do those antibodies stick around? And I think we just need some space to know and test enough people to know. Now, I will say the good news is, because I think some people have been a little worried because we've heard that the antibodies go away and that you could get reinfected again, and sort of a scenario like that. The positive news is that not only are antibodies created from this, but some of the T cells or the memory cells that are part of your immune system, they believe even if the antibody's gone, your T cells or memory cells still have the ability, the memory of COVID-19. It would help protect you in the future, even if the antibodies weren't there, to have a more rapid response to this. So this is some of the newer things coming out, which is, I only bring it up because we only hear mostly bad news about COVID-19. Yeah. And we're all going to just get it 100 times, but hopefully if you do get it, you will not get it again. Or if you did get it again, it would be a much milder version.
That's great. That's okay. And I do have to ask one more question on that much milder version part. If you get it from somebody who had mild symptoms, does that decrease at all your chance of having severe symptoms, or is it purely how your body reacts to the virus?
So there's a caveat to that question. They think that the people with the milder symptoms are potentially less contagious than people with severe symptoms. Okay. But different to answer to your question is, it really is about your body and your DNA and how your immune system works and fights it off to determine how severe the symptoms are for you personally.
Gotcha. So it's not necessarily like a different strain of the virus that would react differently. It's just purely how much you were exposed
Right.
and how your body fights it off.
And I think that's the challenge, is because we don't know, for example, to your earlier point, why children have less symptoms and
Mm.
why those that are greater than 80 years of age have severe symptoms and are at the highest risk of death from this. Because and then, there's a few things that we've teased out, sort of, underlying cardiovascular disease, some other pre-existing conditions, obesity, those all people with those are risk factors for getting sicker and for fatalities. But I think we still don't know enough about the virus to really know who, outside of those that I just mentioned, who else is at risk for this.
Right. Yeah. No, it's such a mystery. The puzzle pieces are still missing.
That's right.
Okay, so moving on from the actual pandemic to some of the fallout from the pandemic, and that I would love to just chat about sports for a second. Kids in sports. I've got 2 boys who play sports, and I am seeing kids, I mean, just silly stuff like falling down more, even if no one tripped them, they just kind of tripped. Or when they fall down, they seem to be getting a little more hurt, and not like broken arms and legs, but like sprains and just like those ouchy injuries that pull them off the field for a little while. And I, as a mom, just wonder if that's because they've been sitting inside for 6 months. Like, tell me about that. Are you guys seeing that? And what can we do? How does that correlate or translate into real life?
Sure. I don't have any data for sure to say whether we all sort of got clumsy during the quarantine or not. Perhaps we did. And definitely kids were out of practice shape just because nobody was practicing. And so I think there definitely some theory that could be true that, yeah, we're getting back out there and going full steam ahead, and we've kind of not really, weren't in peak shape. I know at Legacy R, we have been seeing more sort of sprains and strains. Fortunately, not major injuries, but just the sort of, soccer field, football field kind of injuries, and definitely some overuse injuries too, just because I think we went from 0 to 100 in a very short period. So now I will say that I am glad that the kids are getting back out there and having the sports done. And again, like I said, nothing major, but definitely, we're taking a lot more X-rays and bracing people from sports injuries.
And that's all stuff that you do at Legacy ER. I mean, even broken, do you do casting and all that for broken bones? Tell us what the extent of what they can expect to come to Legacy ER.
Sure. We do the full spectrum, and the nice thing is sort of these sprains and even simple breaks and things like that. That's all urgent care billing, urgent care hours and whatnot. We do also do more severe things like displaced broken bones that require sort of procedures to set them and things like that. Obviously that's done in the ER part of our facility, but we can do all the above.
That's wonderful. And so and I know for those things, it's just like an urgent care, you can just come right in from the field. Right. I didn't ask you earlier, what does the process for COVID testing look like in your facility now? Do we need an appointment? Can we walk in? What's the time? What's the time for the test, et cetera?
Sure. So back to the 3 tests that we talked about earlier, the 2 active tests and then the 1 antibody test. So we can provide all 3 of those tests. Okay. There is no appointment necessary for antibody testing or the PCR test, but those 2 tests do take longer because we do not do them at the facility. We have to send them out. Okay. The antibody test comes back fairly quickly, a couple of days. The PCR test, there's a sort of a wide range on that because it depends on the volume of testing that's being done that day in essentially the whole country. Sure. So it's taking longer, several days. And then the antigen test, we actually do the rapid antigen test. So we'll give you a result before you leave the facility with that. So that's actually the power of that test, is immediately. There is no waiting. That one, we encourage you to go online and make an appointment, just so that you don't have to wait when you come in. We'll take care of you regardless. It's just it probably is better for you as a patient time wise if you make an appointment, because we can get you in faster. But all those tests we can do for anybody who just walks in.
Wonderful. Just had one quick clarification. So between the antigen test and the PCR test, why, if they do the same thing, why would you want to do the one that takes longer, that has to be sent off and all that? What's the benefit?
So there's a little bit of controversy surrounding that,
Oh,
and I think in general the PCR test is considered the gold standard, meaning that it is the most sensitive of all the tests.
okay.
But that's why it also takes longer. But when we're talking nuances. The benefit of the PCR test versus the antigen test is, within percent, less than 10% difference in those. It's, depending on what there's a whole bunch of statistics that are involved in there, but essentially, in my mind, the results are the same, but there is a nuance of difference in those two tests. And so
Yeah.
again, is the balance of waiting, at some point it was 10 days to get the result for the PCR, and
Right.
essentially you've already quarantined, so it's a moot point. And
Right.
so there's where you go back, hey, sure, this test may be a few percentage points more sensitive, but it doesn't help me 10 days from now, as opposed to, the antigen test. I'll know in 15 minutes and I can plan my life based on that, as opposed
Accordingly.
to
Yes.
10
Yeah.
days.
That's great. Okay. Well, thank you so much. This has been so enlightening. And I just really appreciate you taking time to share all the behind the scenes information with our women, knowing that you're local and trustworthy dad right here in town. So thank you so much, Dr. Woody.
Absolutely. I'm happy to help educate us as we all learn together. And I hope everybody stays healthy and safe out there.
Thank you. We will. And we will see you again very soon.